Okay.
Yeah, I know we have a couple more people who'll be joining us.
Yep. Okay.
Coming down.
Give everybody a minute to get in.
Yep.
Happy Friday.
Happy Friday.
Goodness.
Looking forward to the weekend.
And we hope that this will be while it is a presentation, we want it to feel like you are our partners. And so please know that we want to hear your feedback and questions. We'll do 30 minutes in the front end, hope or less. We would love to focus more on the question and answer at the end, so that we can get to it.
Absolutely. Absolutely. All right, Jen, what do you think?
I think we can get started.
All right, that sounds fantastic. So good afternoon. It's so good to see so many of you guys today. Thank you for joining us. And I hope everyone had a wonderful holiday and New Year's. I promise I'm not going to talk about anything political, but I will say that we are just so excited and thrilled about the passage of 2021 NDAA. And we're just relieved and thrilled about all the provisions that are in there for standardizing EFMP and bringing those much needed resources for our exceptional military students in their education. So yay for that. We're thrilled. And that's a one positive political thing to speak about. So I will say it's been a year since our EFMP hearing in front of the House Armed Services Committee. And I just think it's really fitting that today we're releasing our data results based on the advocacy and the partnerships that we've had with you just 12 months later. So the success that we have had this year as an organization would not be possible without our committed partners. So again, I want to say thank you for collaborating with us this year as we continue to delve into the military special education crisis and develop some solutions for our EFMP families. And I apologize, I have a dog. So we've said many times before, hold on a second. Hey, you're gonna be okay. Data drives change and informs policy. Our very first annual survey was a stepping stone for us as we collected that qualitative data and stories from our EFMP families and confirming that there were systemic challenges in accessing a free appropriate public education, which we call FAPE. And that is due to our military lifestyle. The compelling stories, though, really did show that there was a negative impact on their military readiness and retention. Jennifer Barnhill joined Partners in Promise last spring and has been instrumental to our organization as our Chief Operating Officer. We are a small and very efficient all-volunteer team made up of active duty military spouses, and each with our own expertise. We have Carla Wiersch today from Iwakuni. She's a Marine Corps spouse who worked with their EFMP program for several years. We have Crystal Mahaney on board. She's our special education legal analyst from Alabama. She's here with us today. But for Jennifer, she volunteered and to spearhead the first ever comprehensive military special education survey within our military community. And I'm so proud of Jennifer's dedication, research skills, and hard work. She developed, she distributed, and analyzed the results with our academia partners. And it really will help us understand what those educational challenges and barriers are for our EFMP families, and in turn, those results into actionable items. So on that note, I will hand this over to Jennifer to provide an overview of our data results, and we'll talk about the recommendations. And we'll hopefully have the last 30 minutes to conclude with an in-depth Q&A. So off to you, Jennifer, and I will mute.
Michelle. So essentially, there were two items that you all had access to on the Eventbrite site. One is an infographic, and that it will be also emailed after the fact and covered during this presentation. The other is a scholarly paper that focused and honed in on two key findings. So, you know, we are a storytelling organization, so I'd be remiss not to take one quote from our qualitative side of the house and read that to you. So one participant said, "We had a school get rid of supports without a plan to fade them, and then had to collect their own data when my sons started suffering and we wanted them back. This process took a year and a half before they had the data to reinstate the support. My argument was that the incoming out-of-state IEP was all the data they needed. While all of this was happening, my son exhibited new extreme behaviors that we'd never seen before, and his regression is still evident to this day. And this is one of the many qualitative quotes that we have there. And although that is not the focus of today's briefing, we have many more where that came from that we plan to release later on. The focus of this particular presentation is answering this research question of what aspects of the military lifestyle impact the ability for a family member to file for a due process complaint. For those of you who are not familiar with what that means, if a school district does not grant what a parent feels to be an appropriate amount of education to meet FAPE for their student, the only recourse is to pursue legal recourse and sue or file for due process. And so that we wanted to know what about that process was hard, or if it was for military families. So that was our primary focus of this survey. Yeah, there we go. Okay. So as far as demographics are concerned, we had a representative sampling from all branches. We had lower participation from Marines, which was, not necessarily surprising, as it falls in line with the literature review when we look at the programming that is offered, the EFMP programming that is offered for Marines. We had a similarly representative sampling between ranks as far as distribution, but there were higher levels than expected officer participation. So again, I'd be remiss not to cover the limitations of the survey. We had a great response rate with, as help from our partners, getting the word out there. Our distribution direct to family members was through our newsletter. That obviously can lend itself to bias because those individuals have already expressed interest in plugging into the community, as is true of many other surveys that are conducted in this military family space. So, the expected limitations were there, and we have taken that type of information into consideration when reporting out this information. So in the scholarly paper, one of the findings that I was examining, or one of the data points I was examining, was flame filing. And so what I looked at was the relationship between different variables and the likelihood of someone saying that they filed some level of complaint against a school district. And although there were statistically significant findings, the most significant or practical finding that we walked away from was there was no clear pattern of what made someone want to file a complaint. It truly did not matter if their rank did not matter, their location did not matter, their diagnosis did not seemingly matter significantly enough to make a difference, telling us that if people are so unhappy with the school district, they're going to file regardless of how it impacts them financially or emotionally. We also examined EFMP status. So in the survey instrument, we asked the question, are all of your eligible children enrolled in the EFMP program? And the responses were yes, no, and I don't know if we qualify. And so those three responses had very interesting findings, with many who were unaware of the program having a direct relationship with their enrollment had a direct relationship with number of moves. So the more moves that someone experienced, the more likely they were to have been enrolled. Their population of a high military population state did not have an impact on their enrollment. The branch of service did not as well. Their career level also had a relationship with EFMP enrollment. But it was very interesting because the higher levels of enrollment in the lower level of junior rankings, so we had junior enlisted and junior officers were grouped together. And we also grouped mid and senior, because when we look at children, special education, we know that there's different life cycles. And typically those, during the literature review, we outlined the fact that those life situations happen typically mid to senior career level. So you're going to have children in school at those levels. So the findings were really quite interesting. And I would point back to the paper for that. Here we go. So post PCS, we looked at an IEP, what was going on with the IEPs. An IEP is an individualized education plan or program. And so enrollment status had a relationship with IEPs. So basically, if you were enrolled, you were more likely to have an IEP in place. And for those who were not sure if they should be enrolled in EFMP, they were less likely to have an established IEP on the books. Now we're going into the infographic section that kind of covers the overarching findings, and there are so many. So I fully expect people to reach out and we can deep dive into some of those, but for the purposes of today, I'm going to just highlight the ones that were the most impactful in our and impacted our findings and our recommendations. So one of them, as we kind of went over, was EFMP enrollment. And so when you look at the actual numbers here, you can see that they not enrolling in EFMP or choosing not to enroll in this mandatory program was largely due to the fact that they didn't know about it, or they didn't know how to apply. And for those who were familiar and didn't have that knowledge gap, the career was the most cited reason for not enrolling. Additionally, EFMP enrollment status correlated to having less of a likelihood of paying out of pocket. Although we cannot make a direct connection because there are other factors that we were not able to determine if it's a direct connection, but the more plugged into the community, the more likely they were to have other support systems in place. So as you can see on the right, of those not enrolled, there were more junior military who were not enrolled. There were fewer moves and they were more likely to pay out of pocket. So we also looked at the transition, and this was a theme that is not unique to special education. It is a struggle for military families. We examined many questions, and one that stood out in particular was asking if a child was without IEP related services or support. So as a child moves from one location to another, they are supposed to have equivalent services protected for a period of time. And we wanted to find out, was this actually happening? What is the actual experience of our families? And so when we asked this, there were quite a few who said yes, that they were without support. And then of those individuals, how long were they without services? And 79% said that they were without services for over a month. So another area that we pulled out from the data was just the fact that there was a lot of knowledge and service gaps, that they just didn't know what they didn't know. We discovered that there were a lot of wait times that were surprising, where there were quite a few that never responded. They never heard back from certain leadership or resources that were based in the military. And so we also wanted to find out, we knew that EFMP enrollment had a relationship with not knowing about other areas. And so we asked about their knowledge of procedural safeguards that are protected under the Individuals with Disabilities Education Act. So when we asked about that, most were aware, but there were quite a few who were not. And for those who are not familiar, this is something that is part of every process that relates to an IEP, where they're supposed to have presented information in a packet written of what protections are allowed for. So, excuse me. Sorry, I'm letting people in and it's distracting me. Excuse me. And so we also asked if they knew if IEP services were reduced or if there was any notice given, and the knowledge of just not knowing what a prior written notice is. And that's something that is a protection available to our families that they need to know about. And the last kind of section that we were discussing was, again, following up on that claim filing. Based upon the findings and the lack of clear patterns of filing, we very much want to understand why people choose not to continue their claims, because I think that is the area that might give us more information about what parts of the military lifestyle are actually impacting our families, rather than finding out why they do choose to file. So in our subsequent studies, we are going to examine why individuals choose why not to file. But we also did note this question here of why they couldn't continue. And the highest response rate came from the emotional stress that it put on families, which again is something that is a pattern we have noticed in the literature. Stress is a constant factor in many areas of military life, and this is just another one. And so I'm going to turn it back over to Michelle to take some of this data, and now we're going to translate it over to how we can do something about it and what we can do. So thanks, Michelle.
Jennifer, that was really great data. And I think that we all can agree that there's a lot of good that came from the 2021 NDAA. So we're really going to keep an eye on the implementation of those provisions, because, you know, sometimes things are passed, but they're not, the intent is not implemented the way it should be. So our focus this next year is going to be on implementation of those provisions, but also focus on the key takeaways from our survey, which we're going to talk about right now. So that EFMP enrollment that Jen talked about, there's still a lot of stigma related with enrolling in EFMP. And, you know, obviously the results show that enrolling in the program does impact special education, but in a positive way. So I think we need to continue to focus on educating our military community. That's key, particularly our junior service members and their families, as we saw from the data. And I emphasize families because I think a lot of information may not be flowing past our service members. And I want to reflect back about this last year, and let me actually go back to stigma. I think what's important in this approach is thinking about it as a diversity and inclusion issue. You know, we need to apply this mindset to the disability community. So a friend of mine, MJ at PCS Grades, she always says that we're all one breath away from being in the EFMP program. And additionally, if service members see senior leaders openly sharing about their EFMP enrollment, I think that would help families understand that it does not impact their careers and it reduces that stigma. So on a personal note, you know, my husband and I are cognizant that we are in a unique situation as leaders to normalize EFMP and openly speak about the program and its benefits. So we need to continue to reach out, find those senior leaders throughout our military community and partner in messaging about EFMP. Even if our senior leaders are not enrolled in EFMP, but they're educated, they understand the program, they understand the value of the program, I think they will be invested, and that will in turn have a positive impact on our EFM community. That's one thing we're going to look at. Another thing about EFMP enrollment is to clarify how to enroll and disenroll in the EFMP program. A lot of negative feedback from families who choose not to enroll because they feel like their situation is temporary, such as maybe they have a child who has a speech impediment and they feel like just with, speech therapy for a couple years and they're going to be good to go. And then you also have families who have been enrolled who were not even without their knowledge, like their primary care manager just enrolled them because they saw they were going to therapy. So these issues really do add to that myth of like, once you get into this program, you can never get out. And that negatively affects, just the view of EFMP. And also they're, wanting to make sure that they are not limited on what their future duty stations are. So I think the standardization of EFMP that will be implemented this next year, hopefully, will help, but we'll need to probably dig a little deeper into this issue and make sure there's transparency among all the military branches on what their procedures and criteria for enrolling and disenrolling in EFMP. Okay, so main advocacy for us this year is going to be PCS transitions. Obviously, as Jennifer said, it's inherently a stressful time for all families, but then you've got to add in the EFMP piece where you have to have that continuity of care for both medical and special education services. The EFMP program, again, is a great place for that to be for our families before and after PCS to get that support to eliminate those hiccups on the receiving end. So I think with those new provisions of the special education attorneys in the NDAA will be helpful, but we also need to ensure there's other support personnel there for these families. Very similar to the way the Navy EFMP pilot program has been structured. In our survey, families pointed, they're without services for way over a month. That's long.
Michelle, you're muted.
Yeah, I think you might be hitting it accidentally. So.
Oops, sorry about that. Talking about PCS transitions, though, I'm not sure where I left off, but I think I was talking about eliminating those hiccups. When we move from base to base, state to state, and the EFMP is the great central location for that. But we need to really look at what the Navy EFMP pilot program is doing. They have additional support services, not just the attorneys, but they have advocates, people who can actually go to those meetings. And as Jennifer said, a lot of times when you move, you're supposed to have comparable services in place, no matter what, as soon as you get there. And again, those gaps, brings our children farther behind than they were before they moved. And it's just hard to catch up. So we're going to look at remote enrollment. Remote enrollment that is enforceable in every state that has a military presence. We already know that there's 9 states that have in their MIC3 procedures that they should be having remote enrollment. But even in those states, it's inconsistent. So we really need to make sure that we strengthen those existing laws of MIC3 for things like remote enrollment to ensure that when that family arrives to that new duty station, that it will be as easy as possible for them to continue to get the services that they came with in their IEP. And another part of our advocacy is our EFMP families is just the priority of bringing knowledge, and trying to ensure that they understand where those resources are for them. So many don't know what an IEP are, what 504s, what special education law. We know parents are the best advocates for their children, but again, as Jennifer said, you don't know what you don't know. And so I think we need to continue to look at what is available, through the EFMP programs. That one-to-one assistance is so important. Someone who can actually attend those meetings and be able to give guidance, because each child is unique. You can't say that one person who needed speech services is going to be exactly like another person IEP that has speech services. So we need to be able to have that custom assistance in place. And I know there's some folks here today from our parent centers, STOMP, PAVE. They all give great, excellent training to all the military services, and that's fantastic. I just feel like we need to make sure that there is an additional person in place with EFMP that can attend those meetings and be able to provide a sanity check, that everything is going as smoothly as possible with their IEP and their implementation of their IEP. And the last thing about the claim filing, as we realize is obviously we need to know why families are choosing not to file complaints and what are those barriers. Obviously the emotional stress is a big piece of it. And then also knowing it's not worth the trouble if you're going to be moving again anyway in 2 to 3 years. And I know from using my own procedural safeguards through our own experience, it really does take a huge toll on your family in a variety of ways. And so we want to study those barriers in our next survey a little bit more. And how do we help these families emotionally? If they choose not to file, or if they know that there's a lot of stress because an IEP is not being implemented, I think we need to maybe come together as a community, not just all of our nonprofits, even our civilian community, and how we can better support these families with that emotional stress. Because, obviously EFMP families always are stressed out, we're tapped out. And I think that's why up until Partners in Promise came along, it's been hard to organize. It's just we don't have the bandwidth to help other EFMP families as we should. So I think that's something that we want to collaborate more with our community as a whole to try to give that support to them that they very well need. So that's really the focus of our year and our recommendations. And I think we can open it up, Jennifer, perhaps to some Q&A so we can delve in a little bit more into some of this data that we reviewed.
Yeah, I will forward here. So we obviously want to say thank you. And so I just launched a poll, but I would love to hear if anyone has any specific questions about any findings. I could go back on to a slide before we stop the screen share in case there is an area that you are interested in more than another. But this is really your opportunity to test me on how much I really know about the survey data. Put me to the test. I'm ready, or at least I'm going to try. And if we don't, we have some questions that we've had submitted ahead of time. And so if there isn't any questions at the moment, we'll go ahead and go to those while you're thinking about it. And so one of the questions was just wanting to know who responded. And as I mentioned earlier, Marines had a lower than expected response rate. We had a high response rate from military spouses, which is not necessarily surprising given the snowball methodology in distribution. That's not surprising in doing literature reviews in this area. The other question was, what will the 2022, can't believe we're talking 2022 survey address? We are very much hopeful to increase our branching in our surveys. So we want to understand what in this call and in relationships and meetings in the future of what factors are interesting to you so that you in your respective organizations can help assist your demographics. So if we're doing the deep dive, not everyone needs to do the deep dive into special education. We're doing that, and we're happy to help to share our information. So we're hoping to do increased branching and again, find out a little bit more about why people chose not to file, because if that is the only method of getting the education that these children so deserve and are entitled to by law, we need to make sure that that is protected for our military children. And as we discover how the starting of a new IEP is a lengthy process, and there are some guidance as far as the deadlines and the due dates, but when it comes to things like testing in a COVID environment, we're even more unsure of how long it's taking families to adjust during COVID. So we're really we need to strengthen this now while eyes are on special education, especially with COVID, because we, as the military life constantly impacts us, we want to be ready for the next version of this for our families. And I think I see some chat, so I'm going to stop sharing and we'll, here, let's go over here. Okay. Let me see here. Okay, I'm going to, so we have in the chat, we go back to the top. Okay. Is there a breakdown by service branch for all of the data? So we do have breakdowns. We have the raw data, but that is something, and this is something I want to make available to everyone, is that if you have a specific question about your service branch or a topic that you want to see how something performed, how they responded in a certain type of question, I'd be happy to set up a separate call. If you have a specific question about service branch feedback, we didn't have the findings when looking at EFMP enrollment were not statistically significant between the different branches of service. And so if there is a specific question that relates to service specific, I'd be happy to meet with you about that. Or I can make a note to report out on that as a blog post or something similar. And Jessica asked about, I'm gonna stop the screen sharing so we can be here. She asked about ADHD as one of the diagnoses. I know, so we had diagnoses all aggregated into one of mental health. And so I believe, well, excuse me, I'm thinking anxiety. Let me pull up the exact. Michelle, do you want to take one of the next questions, and I will pull up the data so I can actually get accurate information?
Sure.
Sorry, it's me. I have a
Absolutely.
lot
And
of
I know-
questions.
No, you're totally.
No, this is great. Actually, I love chatting about this. And typically ADHD, again, is a comorbid diagnosis. And so it's kind of lumped sometimes with autism and anxiety as well. And I don't want to speak before Jennifer brings up the information, but most of the time it's with those diagnoses or they're on a 504. You know, you usually do not just see ADHD on an IEP. And so that's probably why it's mixed in a little bit with some of the other diagnoses, but I'll let her look that up for you just to make sure. But I know it's extremely hard just because they feel that the 504 can accommodate most of these kids that have an ADHD diagnosis. So let's see. More about dual EFMP enrollment, multiple fountains.
Yeah, that's a little less related to like educational,
Right.
this educational supports from the EFMP program. I just think I know in looking at caregivers, I know that caregivers often have a higher rate of mental health diagnoses as well. And those are also triggering diagnoses for EFMP enrollment. So those who are choosing not to be enrolled, are they choosing not to be enrolled because of the more than one member, or do the reasonings change or the enrollment change when you start having more than one family member who qualifies for enrollment?
So yeah, we noticed, so there were questions of how many children do you have, and then how many children do you have in special education, and so there were yes, if they had multiple children, it wasn't necessarily statistically significant numbers, but it was interesting findings. So yes, there was a relationship, but it wasn't necessarily statistically significant enough to make a connection. But yes, there was a likelihood if there was a second child, if they were already enrolled in EFMP, that they did not feel it was necessary to enroll their second child. So there was relationship, but it just wasn't statistically, and I'm happy to share what we did find. It just wasn't one that was in here. So I'm making notes here, everyone. So I will get back with everyone. On the spot, I might not be able to give you the data. I want it to be right, not fast. So I will get Jessica and anyone else. So we have ADHD. We did have it separated out. It was a separate diagnosis listed. We had anxiety listed with mental health. And so that I was getting my A's a little confused, but it was separated out. And we do have findings that are diagnosis specific. None of them were enough to have any real practical findings because of the fact that there's comorbid diagnoses in the way that the survey instrument collected data. It didn't allow for linear regression models. So it was hard to build a model that would give a real picture of what was happening for a diagnosis from within this community. So as we go forward in our survey and how we build it out, I have so many plans now, having seen the data come back. But it's definitely something we're hoping to be able to dive deeper. But we also want to just know it's interesting to find out a lot of data. We have a lot from this survey. There's abundance about this very specific topic, but what can we as a community do that actually can make change for our families in order to make, we're not necessarily out, we want it. Can we correct special education? We would love to. That would be wonderful. That'd be so great, right? We're all volunteers and that would be amazing. But we know that we're out to help reduce the hurdles that are faced by military families specifically. And so what in our surveys can we ask that will get us to that point? And so that's where we're going with some of our survey questions, but I definitely want to hear the areas of specific interest from our partners. Sorry, I can talk. I'm sorry. Let's see here.
Hi, can I ask a question?
Yeah.
I'm driving, so I couldn't raise my hand, but I wanted to ask
No,
a question if possible.
Hi, Yasmin.
I'm Yasmin, and I'm with the STOMP program director for the STOMP program. But one of the questions I had, or I guess comments, is like the EFMP specifically. Maybe I would be interesting to get information from parents on why they more deterred. Was it like what type of education or like certification or training are the EFMPs getting? Is it continuous education in the special education field of the state laws and federal laws? Just from some of the things that we've learned through our training and some of the feedback that we've gotten or responses from like registration forms, one of the questions we ask is, why are you attending this workshop? And we've had some say, because it's hard to get enrolled in EFMP at certain installations. So why is that? Is it because the EFMP may not know some of the things? So is that a deterrent, or EFMPs not being as knowledgeable just for the simple fact that they may be new? So is there specific training that EFMP gets that is specific for our families, our EFMP families? And is it continuous? Because that's some of the feedback that we're getting from our families, and what makes it difficult, or why they kind of shun away from enrolling in EFMP.
Mm-hmm. Yeah, there was that knowledge gap. And so I think that I've interviewed school liaison officers who are not familiar with the things that are on paper that they should be familiar with. And so I think that it's the single point of failure if you're in an area that doesn't have someone who is educated. But yes, standardization of the educational process. There is, I think, Michelle, if you can speak, is that addressed at all with the Navy pilot program?
I think what you'll find is because the Navy pilot program is focused in two heavily, occupied places of Navy personnel, you can tell that they're on the ball and they are doing fantastic training. I'm, on both of their Facebook pages, well, actually for the San Diego area, and they are just whipping out trainings left and right. So I think that, it's going to vary by service branch. And I think that is something that I'm hopeful with the standardization that is mandated by the 2021, that we will see more consistency on, making sure that these families have all of the important pieces of IDA, they know the procedural safeguards and what resources are available to them. We get people all the time reaching out to us from recruiting stations and, these one-off type locations that they're lost. They don't feel like they're part of the bigger EFMP community and they don't know where to go for any of this training. So that really is something that's been, talked about for over a decade. So that's really the main focus on EFMP, is ensuring that they're all doing the correct training and supporting families. And again, I think in the past, EFMP has been very focused on the medical piece. It really hasn't been until this last couple of years where we've been able to elevate and amplify special education issues. So this is a new territory for service branches to all of a sudden realize that this is really impacting our families, their readiness and their retention. And so I love what you guys are doing as far as providing training, I believe, for the Air Force and the Army particularly. And we just need to ensure that, all of them are getting the same quality training in their state, because of course it changes state to state.
Yep.
Does that answer your question, Yasmin?
It does. Thank you. Thank you. I appreciate it.
So another question, let's see here. We have a question about, did respondents report commands? No, we did not ask. We allowed for anonymous survey. We did ask for location via zip code to get a better handle of what school districts they might be associated with. The complication there is that we could not get the data to align based on current location and the feedback. So they gave feedback of their collective experience with special education over the course of their military career, so to speak, and it didn't necessarily relate to where they were right now. So as we look to our next survey, we are going to have more location-based questions that focus on where the experiences, these qualitative and quantitative responses are coming from, so we can get a better feel. But no, we're not, we did not want to limit our data by asking for that type of information, which we feared would hamper honesty.
Yeah, I agree with that. That's always been a problem with people even filling out the survey. They really just don't want to give any identifying information because they are worried that someone in their command is going to find out. So it's really a catch-22, right? Because we're trying to figure out where are they being best supported and where they're not being supported. But yeah, we have a couple of barriers that we have to get through to that point. And I think as we, because we were such a new organization last year, as we work in this space longer, it will be, I think, easier maybe to get some of that information because there'll be a trust and a credibility associated with it.
Another question was, do you happen to have any results relating to DODEA schools? And we did ask satisfaction levels for both, for all types of school modalities, I would guess is maybe the right word. I'm trying to use a word that I don't use often, so forgive me. But if we did ask for private, public, charter, homeschool experiences, we asked them to rate their, on a Likert scale, their best experience and their worst experience. And in the findings on the paper, we overlaid those into one question. I believe that the focus was for public, the worst schools. So we did have a best as well. And then we had some qualitative responses for DODEA. And so that was definitely findings we can report out and discuss. If you wanted to reach out to me, I will put my email in the chat, and you can always request a separate meeting. We don't want to, unless everyone raises their hand and said that they want that as well, we'll just meet one-on-one to get those kind of drilled in data points. So, and does anyone, I'm sorry.
I'll just add to that. We do know that we need more information about DODEA, certainly. And that will definitely be a deep dive in the next survey. I think we're ready for that next part of the process.
I do have a question, and I can either put it in a poll or I can ask, if you want to send it to me yourselves, is what would you like to know more about? Either through us writing about it, specifically talking on one topic, or questions that we might be able to include in our next survey. We are hopeful that we can have kind of another meeting with our partners, or even if it's just a one-on-one here and there as we're available, to help inform our future surveys. We believe in partnerships, and I think that that's the reason why we've been so successful so far. So we definitely want to hear from you. Does anyone have any feedback that you're willing to go on and share about? If not, that's okay. It's Friday of a really hard week. So
I just want to say thank you, Jennifer. It's amazing it's great data and I think we also know what we need to look into more next year with our next survey. So we'll have a plan to move forward. But with this data that we have right now, I think we can inform leaders that are in the position to make change to support our EFMP families. And we'll be posting our goals as Partners in Promise probably by the end of the month. 50% of our Promise Act initiatives were incorporated in the 2021 NDAA. And the next initiatives are really kind of embedded in these recommendations that we talked about today. So, not all can always be accomplished through the NDAA. And we also kind of need to wait a little bit on that GAO study that's going to be completed on special education. And that will kind of help us focus on which way we need to go in the future. But, my motto is always, together we're stronger. So I look forward to our organization collaborating with you guys individually and collaboratively as we improve our educational outcomes of our military students with special needs. So I just thank you guys so much for joining us and taking time today. And providing some great feedback, and hopefully we can schedule some meetings after this and keep going forward for this year.
And as far as takeaways and asks, there are ways that we can help each other. We will be putting this out to the public on February 1st. It will be on our website. So, and we will put that out on our newsletter. So you'll see that official announcement come through. So if you're able to share, get the word out on our partnerships, and that would definitely be helpful. And we just want people to know, but this is what we need to do to strengthen this program. And it's not that hard. It's not that hard. No. I hope it's not anyway. I'm sorry. I'm ever the optimist. Michelle kind of laughs at me. However, sharing the results, continuing the collaborations and the conversations, reach out to me to help inform how we can help improve surveys in the future, and then keep reaching out to those in leadership with this information. Dee, did you have a question?
Hey, yes, I wanted to come off mute, but I didn't want to interrupt. Hi, this is Dee. I am also a Navy spouse. Woo, go Navy. And I won't say be Army because we love our Army too. But yes, I was asking about the DOJEA schools because we're finding that a lot of our families are coming to parent training centers. Parent training centers are saying you're DOJEA, and there's a lot of disconnect. But DOJEAs also follow IDEA, and yet we all know that IDEA is not always followed, whether it's DOJEA or a public school here in the United States. So I would love to see what kind of trends or correlations you find in regard to that. And because you're doing such wonderful research, and thank you for that, I would love to see more questions in the future relating to people's experiences. We hear feedback on everything that's good, bad, and in between, just like you. But I know that's an area that I think there's a lot of room for information there. There's also room for education there. That's one of the things that tends to be a big question mark for our families. How do you even begin to address this issue? Because it's DOJEA, it's not federal. And again, the parent training centers and trying to connect the dots of what they can do to help these families through. So yes, any information you can bring from that would be fabulous. And I'm very excited to see the full results and everything from this. So anyway, sorry, that was more of a comment than a question, but thank you so much.
Well, thank you, Dee. And you guys are doing such a great job. Thank you for helping out those families. And it's just so ironic because 30 minutes before I got on this, I was spending time with an Army spouse who was trying to help another Army spouse. She was asking if we knew any type of special education attorneys that knew about DOJEA law. And I'm thinking to myself, DOJEA law. It's all IDEA. They don't have a different set of rules that they need to follow. In fact, Crystal, I'm going to bring you in here. Crystal is our legal analyst. Okay, I'm sure that you hear something about this, that maybe things are done differently in DOJEA.
Well, I think one thing that we can all agree on, go Army, beat Navy here, is that no matter what installation you're at, it's all going to be different. And so versus just outside the installation, life is a little different for civilians. We know that. My question that I jotted down actually is to your comment, Dee, is the examining the conflict resolution within DODEA schools, because if you call DODEA, so they track all of their students that go in and out of DODEA schools. They don't track students that come into a DODEA school and leave a DODEA school to go into a public or private setting. So if there are children, the special education kids within DODEA fall under, when they're in DODEA, they only fall under DODEA. When they leave DODEA, they are no longer DODEA kids. So I think one thing we should examine is why that is the conflict resolution different, and what is their IDEA compliance, and how does that compare to public school?
That is exactly the information I would love to see come about, because they do have their own Center for Dispute Resolution. They do have their own procedural safeguards. And we were just talking with one of our colleagues who works with a PTI, and she was noting that, yes, there are different names within DODEA and the equivalent under IDEA. It's an equivalency. It still meets the requirement, but it's a different name, and that causes confusion.
Yeah.
So just one of many things.
Yeah, but it's definitely worth the deep dive, because even if some of our kids at some time is probably going to be in a DODEA school, it's going to be a combination because we move so frequently. I know we experienced that in mine. My kids started in special education at a DODEA school at Fort Carson, and it was not great comparatively to other places that we've been. So I think it's a really good suggestion that we should examine that very closely.
So so as we dig, and we're not going to do this for every topic, but I want to give an example of how, if you have a specific deep dive question you would like to address or dig deeper into the data, I can share one example of looking at what we're discussing now and comparing the questions that were asked about, let's say, private schools to the DODEA experience. And I'm going to pull that up and share in a second. And it's believe it or not, it's not presentation worthy, but it'll get the job done for now. So let me just share my screen really quick. And again, we're partners, so I hope there's no judgment of my desktop. So here we go. Okay, so we have the worst public school experience and the worst DODEA school experience here. And so you can see that when you overlap them, there's definitely a different experience. So we can do different, we can meet together to find out the ultimate purpose and goal, essentially because our focus was a very limited, question. Our survey question was very specific. We did not deep dive into every topic, and we don't plan on doing that unless we're asked to do so, and we'll be happy to do it. But for now, if you have any specific questions, do not hesitate to email me, and we can set up a meeting and we can review the data. So if anyone has any additional questions,
Just want to add a comment really quick that, sorry, just came to me. With the question of why is DODEA different, policy different, they have the same ability to write their own script for compliance and implementation as any other school district does. There's federal law, state law. School districts decide policy and regulate policy and procedures on their own. So DODEA is going to be, I think that's fundamentally why DODEA is different than public schools.
Does anyone have any last minute questions? I want to be respectful of everyone's time. We have about a few minutes left. Is there any other questions? Did anyone have issues accessing the paper or infographic from Eventbrite? Okay. Okay. Alrighty, well, it looks like I'm going to send out an email following up with the data and the paper. So I'm happy to get that directly to everyone who attended. So if you have any questions, again, you can just respond to my email. Thank you everyone for coming. And Michelle, I'll pass it back to you.
Yep. Just again, thanks for everyone for spending your time today on a Friday before a weekend. And we look forward to chatting with you guys individually, and great stuff ahead for this year. So let's do it together. So thank you. Have a great weekend. Take care.